Schizophrenia starts between ages 15 and 25 for men and between 25 and 35 for women. It also tends to affect men and women in equal numbers. About 20% of new schizophrenia cases occur in people over age 45. These cases tend to happen more in men. Schizophrenia in children is rare but possible. When schizophrenia does start in childhood, it's usually more severe and harder to treat. Many people with schizophrenia can't recognize that they have symptoms of schizophrenia, but those around you might. These are 5 main symptoms of schizophrenia. Number 1. Delusions. These are false beliefs that you hold even when there's plenty of evidence that those beliefs are wrong. For example, you might think that someone is controlling what you think, say, or do. Number 2. Hallucinations. You still think you can see, hear, smell, touch, or taste things that don't exist, like hearing voices. Number 3. Disorganized or incoherent speaking. You may have trouble organizing your thoughts while speaking. This might look like trouble staying on topic, or your thoughts might be so jumbled that people can't understand you. Number 4. Disorganized or unusual movements. You might move differently than people around you expect. For example, you may turn around a lot for no clear reason, or you might not move much at all. Number 5. Negative symptoms. These refer to a reduction or loss of your ability to do things as expected. For example, you might stop making facial expressions or speak with a flat, emotionless voice. Negative symptoms also include a lack of motivation, especially when you don't want to socialize or do things ordinarily enjoy. Because of these symptoms, you might feel suspicious, paranoid, or scared. You do not care about your hygiene and appearance. You may also experience depression, anxiety, and suicidal thoughts. Use alcohol, nicotine, prescription medications, or recreational drugs to try to ease your symptoms. What causes schizophrenia? There's no one single cause of schizophrenia. Experts suspect schizophrenia happens for different reasons. The 3 main reasons include imbalances in chemical signals your brain uses for cell-to-cell communication, brain development problems before birth, and loss of connections between different areas of your brain. What are the risk factors of schizophrenia? While there aren't any confirmed causes of schizophrenia, there are risk factors for developing the condition. Number 1. Environment. Many factors in the world around you can increase your risk of developing schizophrenia. Being born in winter increases your risk slightly. Certain illnesses that affect your brain, including infections and autoimmune diseases, can also increase your risk. Number 2. Development and birth circumstances. How you developed before you were born plays a vital role in schizophrenia. The risk of having schizophrenia goes up if your birthing parent had gestational diabetes, preeclampsia, malnutrition, or a vitamin D deficiency while pregnant with you. The risk also increases if you were underweight at birth or if there were complications during your birth. Recreational drug use. Schizophrenia is linked with the use of certain recreational drugs, especially in larger amounts and earlier in life. The connection between heavy marijuana use as a teenager is one of the best studied of these links, but experts aren't sure if marijuana is a direct cause of schizophrenia or if it's just a contributing factor. Is schizophrenia genetic? Experts haven't found one specific cause of schizophrenia, so they can't say for sure if genetics cause schizophrenia. But if you have a family history of schizophrenia, especially a parent or sibling with it, you have a much higher risk of developing this condition. Diagnosis and test. According to the DSM-5, a schizophrenia diagnosis requires the following: at least 2 of the 5 main symptoms, at least you have had the symptoms for 1 month, your symptoms impact your ability to work or your relationships, may be friendly, romantic, or professional, or otherwise. Can schizophrenia be cured? Schizophrenia isn't curable, but it's often treatable. In a small percentage of cases, people can recover from schizophrenia entirely. But this isn't a cure because there is no way of knowing who will relapse and who won't. Because of that, experts consider those who recover from this condition in remission. Thank you for watching this video.